Did you know that nearly 80% of strokes are preventable with simple lifestyle changes? Imagine being able to reduce your risk of such a life-threatening event with just a few adjustments. In today's video, we'll show you how to not only prevent strokes, but also support recovery through natural methods. Stay tuned as we dive into these surprising tips that could make all the difference in protecting your health and your future. 1. The danger of stroke in the elderly. Why action is urgent. Stroke is one of the leading causes of death and long-term disability in older adults. In fact, the risk of having a stroke increases significantly as we age, making it an important health concern for seniors. The consequences of a stroke can be devastating. Immediate effects like speech difficulties, weakness in limbs, and trouble with coordination can drastically change a person's life. Without swift medical intervention, the risks grow even more severe, leading to lasting disabilities, loss of independence, and in some cases, even death. But here's the most alarming part. Most strokes are preventable. This means that with the right steps, you could potentially avoid the physical and emotional toll of a stroke entirely. The majority of strokes are caused by lifestyle factors such as high blood pressure, poor diet, lack of exercise, and stress. By addressing these risk factors early on, we can significantly reduce the likelihood of having a stroke. If you ignore these risk factors and don't take action, you may find yourself dealing with more serious health complications down the road. However, the good news is that making small, manageable changes now can help you avoid those severe consequences and even reverse some of the damage. Let's take a closer look at how natural methods can help you prevent and treat stroke. 2. Effective natural interventions for stroke prevention and treatment. When it comes to preventing and treating stroke in the elderly, natural methods can make a significant impact. The key to reducing stroke risk and aiding recovery lies in adopting a proactive approach to health. This involves making thoughtful lifestyle choices, using natural remedies, and integrating strategies that enhance overall well-being. In this section, we'll explore practical and effective natural interventions that can help in preventing strokes and supporting recovery. Healthy diet, a foundation for stroke prevention. One of the most important steps in reducing stroke risk is adopting a healthy, balanced diet. A diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can lower cholesterol, reduce blood pressure, and keep your arteries clear, all of which are critical in preventing stroke. Foods high in antioxidants, such as berries, leafy greens, and citrus fruits, help reduce inflammation and improve blood flow. Omega-3 fatty acids, found in fatty fish like salmon, sardines, and mackerel, are known to reduce the risk of stroke by preventing blood clots and supporting heart health. Omega-3s help reduce triglycerides, lower blood pressure, and increase the flexibility of blood vessels. For those who don't eat fish, flax seeds, chia seeds, and walnuts are great plant-based sources of omega-3s. Another powerful food for stroke prevention is garlic. Studies suggest that garlic may help lower blood pressure and reduce plaque buildup in arteries, further supporting overall cardiovascular health. Garlic can be easily added to a variety of dishes, from soups and salads to roasted vegetables, making it a simple yet effective way to support stroke prevention. Regular exercise, the natural way to boost heart health. Exercise is a cornerstone of stroke prevention. It doesn't have to be intense or time-consuming. Regular moderate exercise can go a long way in reducing stroke risk. Aim for at least 150 minutes of moderate intensity exercise per week, such as walking, swimming, or yoga. These activities can improve circulation, lower blood pressure, reduce cholesterol, and promote overall heart health. Incorporating strength training exercises, such as light weights or resistance bands, helps maintain muscle mass and improve balance, which is essential as we age. Strength training also helps regulate blood sugar levels, which can reduce the risk of developing diabetes, Another risk factor for stroke. If you're new to exercise or haven't been active for a while, start with simple activities like short walks or stretching. As your fitness improves, gradually increase the intensity and duration of your workouts. For those with mobility issues or joint pain, water aerobics or chair exercises can be great alternatives that still provide significant health benefits without putting too much strain on the body. Managing blood pressure naturally. High blood pressure, also known as hypertension, is one of the biggest contributors to stroke risk. Over time, high blood pressure weakens blood vessels, making them more likely to rupture or develop clots. Lowering and managing blood pressure naturally is essential for stroke prevention. One of the most effective natural ways to lower blood pressure is through dietary changes, particularly reducing sodium intake. The American Heart Association recommends limiting sodium to no more than 1,500 milligrams per day, especially for older adults. Opting for fresh, whole foods rather than processed or packaged meals can help keep sodium levels in check. Additionally, potassium-rich foods like bananas, sweet potatoes, spinach, and avocados can help balance the negative effects of sodium and lower blood pressure. Magnesium, found in foods like almonds, seeds, and leafy greens, has also been shown to support healthy blood pressure levels. Regular physical activity, managing stress, and maintaining a healthy weight are also essential components of blood pressure management. Techniques such as deep breathing, mindfulness meditation, or yoga can significantly reduce stress, which is a key contributor to high blood pressure. Natural supplements supporting stroke prevention. In addition to diet and exercise, several natural supplements have been studied for their potential to reduce stroke risk. Here are a few that may offer support. Omega-3 fatty acids. As mentioned earlier, omega-3 fatty acids have been shown to reduce stroke risk by improving blood flow and preventing blood clots. Fish oil supplements are an easy way to incorporate more omega-3s into your diet if you don't consume enough through food. Ginkgo biloba. This herb is known for its ability to improve circulation and reduce the risk of blood clots. Some studies suggest that ginkgo biloba may help prevent strokes by improving blood flow to the brain and preventing cognitive decline. Turmeric. The active compound in turmeric, curcumin, has powerful anti-inflammatory properties that help reduce plaque buildup in the arteries and improve blood circulation. Adding turmeric to your diet, either through food or supplements, can provide a natural boost to your heart health. Coenzyme Q10 or Q10. Coenzyme Q10 is a powerful antioxidant that helps protect blood vessels from damage. It may also improve blood pressure regulation and enhance energy production in cells. Taking Q10 supplements may offer support for overall cardiovascular health. Mind-body connection. Reducing stress for better health. Chronic stress is a significant risk factor for stroke, particularly in older adults. When we're stressed, the body releases hormones like cortisol and adrenaline that can elevate blood pressure, increase inflammation, and damage blood vessels. Reducing stress through relaxation techniques can help lower stroke risk. Mindfulness practices, such as meditation and deep breathing exercises, can activate the body's relaxation response, reducing heart rate and blood pressure. Yoga is another excellent practice for managing stress, improving flexibility, and promoting overall well-being. Even simple activities, such as taking a walk in nature or spending time with loved ones, can help reduce stress and improve mental clarity. Rehabilitation, supporting stroke recovery naturally. For those recovering from a stroke, natural therapies can play a key role in rehabilitation. While professional medical treatment is essential, incorporating natural methods like acupuncture, massage therapy, and gentle exercise can speed up recovery and improve quality of life. Physical therapy, whether traditional or through gentle methods like water therapy, can help improve strength, mobility, and coordination. Cognitive exercises, such as puzzle games or memory activities, can support brain health and help patients regain lost cognitive function. Natural remedies, including herbal teas with calming properties, can also support stroke recovery by reducing anxiety and promoting restful sleep. Building a holistic recovery plan that includes both medical care and natural therapies can help improve the chances of a full recovery. 3. Alternatives and supportive therapies for stroke prevention. When it comes to stroke prevention and treatment, one size does not fit all. While the core interventions we discussed, healthy diet, regular exercise, and natural supplements, are incredibly effective for most people, there are alternatives that can be just as beneficial. These alternatives are especially important for those who might not be able to follow the main strategies due to personal preferences, physical limitations, or underlying health conditions. By knowing what options are available, you can choose what works best for you or your loved ones. Equivalence: achieving the same goal with different methods. For individuals who may not be able to engage in regular physical activity due to mobility issues or chronic pain, alternatives like water therapy or chair exercises can be incredibly effective. Water therapy, or aquatic exercise, is a low-impact activity that offers the benefits of cardiovascular exercise without putting too much strain on the joints. It's particularly helpful for elderly individuals or those recovering from surgery or stroke, as the buoyancy of the water supports the body and reduces stress on the joints, while still providing a solid workout. If you're unable to change your diet drastically due to other medical conditions or preferences, there are still ways to incorporate heart-healthy foods without overhauling your entire eating routine. For instance, substituting unhealthy snacks with healthier options like nuts, seeds, and fresh fruits can be an easy step in the right direction. Even adding small amounts of omega-3 rich foods like flax seeds or walnuts to your meals can provide significant cardiovascular benefits without requiring a complete diet transformation. Additional support: enhancing stroke prevention with other remedies. In addition to the core interventions, there are also natural therapies that can offer partial enhancement to the primary treatment plan. Acupuncture, for example, has been used for centuries to support circulation, relieve stress, and promote overall well-being. While not a replacement for traditional medical treatments, acupuncture can complement stroke prevention and recovery by stimulating blood flow and reducing tension, which is essential for those looking to manage stroke risk naturally. Another option for those who need extra support is cognitive behavioral therapy, or CBT, especially for those dealing with stress or anxiety, both of which can contribute to higher stroke risk. CBT helps individuals change negative thought patterns, manage emotions, and cope with life's challenges, ultimately reducing the impact of stress on the body. For those with intolerance to certain herbs or supplements, it's important to find alternative ways to support stroke prevention. In some cases, lifestyle changes such as mindfulness practices, yoga, or even engaging in regular social activities can help boost overall health and reduce stroke risk. Choosing the right alternative for you. When it comes to choosing alternatives, it's crucial to weigh the benefits and limitations of each option based on your health status, lifestyle, and preferences. Always consult with your healthcare provider before making any significant changes to your health regimen, especially if you have underlying conditions such as diabetes, hypertension, or heart disease. The key is to find a balance between what works for your body and what's sustainable in the long term. With the right combination of alternatives and core interventions, stroke prevention can be both personalized and effective. By staying flexible and open to different approaches, you can find the best methods for your health journey. As we move forward, it's important to keep safety in mind and ensure that whatever methods you choose are backed by sound evidence and guided by a healthcare professional. 4. Contraindications, warnings, and safety guidelines for natural methods. When it comes to stroke prevention and treatment, safety should always be a top priority. While natural methods can be incredibly effective, it's essential to recognize that some approaches may not be suitable for everyone. Understanding contraindications and warnings is critical for making informed decisions about which natural remedies to use. This section will highlight the health conditions and medications that require careful consideration, signs to watch out for that may indicate the need to discontinue a particular treatment, and general safety guidelines to ensure that the natural methods you choose are both effective and safe. A. Health conditions and medications requiring professional consultation. Before starting any new treatment, particularly with natural supplements or herbal remedies, it's crucial to consult with your healthcare provider, especially if you have pre-existing health conditions or are taking prescription medications. Certain herbs, supplements, or lifestyle changes may interact negatively with medications, leading to side effects or diminished effectiveness of the prescribed treatment. For example, individuals with high blood pressure who are already on medication to control their blood pressure should be cautious when using natural supplements like garlic or ginkgo biloba. These herbs are known to have blood-thinning properties, which could amplify the effects of blood pressure medications, potentially leading to dangerously low blood pressure. Similarly, people on blood thinners such as warfarin should avoid high doses of certain herbs like turmeric, which also have anticoagulant effects. Those with diabetes should consult their healthcare provider before using natural remedies like cinnamon or bitter melon, which can lower blood sugar levels. While these herbs may offer benefits, they could lead to hypoglycemia, low blood sugar, if combined with diabetes medications. If you have a history of heart disease, kidney problems, or liver disease, it's important to carefully monitor the use of supplements like omega-3 fatty acids or coenzyme Q10, which may not be suitable for all individuals in these categories. B. Signs that require immediate discontinuation and seeking assistance. While natural remedies can be incredibly helpful, it's essential to recognize when something might be going wrong. Certain side effects or warning signs may indicate that a treatment should be stopped immediately. For example, if you're using herbal supplements and experience symptoms such as dizziness, nausea, excessive bruising, or unexplained bleeding, it's crucial to stop the treatment and consult your healthcare provider. These could be signs that the herb is interacting negatively with your medications or that you're experiencing an allergic reaction. Similarly, if you start feeling lightheaded or faint, especially when standing up quickly, this could be a sign that your blood pressure has dropped too low, possibly due to the effects of a natural remedy combined with blood pressure medications. If you notice any unusual changes in your health after starting a new treatment, such as irregular heartbeats, severe headaches, or shortness of breath, it's important to seek medical attention right away. C. General safety guidelines. To ensure the safety of your natural treatments, always purchase supplements from reputable sources. Look for products that are certified by organizations like the USP, United States Pharmacopoeia, or NSF International, to ensure that they meet quality and safety standards. Avoid exceeding the recommended dosage of any herbal supplements or natural remedies, as high doses can lead to toxicity or undesirable side effects. Follow the guidelines provided by your healthcare provider or the instructions on the product packaging. It's also a good idea to keep track of any natural remedies you're using, including herbs, supplements, and lifestyle changes. This will help you and your healthcare provider monitor your progress and ensure that you're not unintentionally overloading your system with too many supplements or making conflicting changes to your routine. Finally, always listen to your body. If you start feeling unwell or notice something that doesn't feel right, stop the remedy and reach out to your healthcare provider. It's always better to be cautious when it comes to your health. D. Bridge to improvement indicators. Understanding contraindications and warnings is just one part of the puzzle. Once you've ensured that your chosen remedies are safe and appropriate for your needs, the next step is to monitor your progress. In the next section, we'll explore how to track your improvements and make adjustments as needed to ensure that your stroke prevention plan is working effectively. 5. Tracking progress. How to monitor improvement in stroke prevention and recovery. Tracking progress and recognizing improvement is a crucial part of any stroke prevention or recovery plan. Whether you're focusing on prevention or recovering from a stroke, knowing how to monitor your health is key to staying on track. In this section, we'll explore the subjective and objective indicators of improvement, how to set reasonable expectations, and how to adjust your approach to ensure ongoing progress. Recognizing the signs of improvement can help maintain motivation, ensure that your efforts are working, and provide peace of mind that you're on the right path. A. Subjective indicators. How you feel. The first indicators of progress often come from how you feel on a day-to-day basis. Many people begin to notice improvements in their energy levels, mood, and overall well-being as they start adopting healthier habits. If you're focusing on stroke prevention, you might find that you have more energy throughout the day, less fatigue, and improved mental clarity. These early signs of improvement are not only encouraging, but also indicate that your lifestyle changes are having a positive effect on your body. For individuals recovering from a stroke, subjective indicators may include better mobility, improved speech, or a greater sense of mental alertness. As you continue with your natural treatments, whether it's through exercise, dietary changes, or mental health practices, these improvements in how you feel should be taken seriously, as they are often early signs that your body is healing and adapting. B. Objective indicators. Measurable changes. While how you feel is important, objective indicators provide a more tangible measure of your progress. For example, regular blood pressure monitoring is an excellent way to track improvements in cardiovascular health. If your blood pressure is consistently lower after incorporating natural remedies, it's a clear sign that your efforts are paying off. For stroke prevention, tracking cholesterol levels, blood sugar levels, and even your weight can give you insight into how your health is improving. If you notice a decrease in cholesterol or better management of blood sugar, these are strong indicators that your efforts to prevent a stroke are working. For stroke recovery, measures might include improved range of motion, strength, and cognitive function. This can be tracked through regular assessments with your healthcare provider or physical therapist. Keeping a record of these improvements, such as the ability to walk longer distances or perform activities you struggled with previously, can help you visualize progress and maintain motivation. C. Time frame and expectations. It's important to set realistic timeframes for improvement, recognizing that the process can take time. For example, while you may start feeling better within the first week or two of making changes, more significant improvements, such as lowered blood pressure or enhanced mobility, may take a few months. Be patient with yourself and set reasonable goals for short-term, medium-term, and long-term improvements. It's also important to remember that not all improvements are linear. There may be times when progress feels slower or when you hit a plateau. Don't be discouraged. This is a natural part of the process. Regularly reviewing your goals and adjusting your approach based on your progress will help ensure that you continue to move forward. D. Encouraging consistency. To further track progress, it's helpful to keep a health journal. By writing down your daily habits, meals, exercise routines, and any changes you've noticed in how you feel, you'll be able to track patterns over time. Keeping a log can also help identify what strategies are working best for you and what might need adjustment. Having a consistent routine such as regular exercise, healthy meals, and mental health practices is key to seeing continuous improvement. If you find that some methods are not yielding the results you hoped for, don't hesitate to make changes or consult with a healthcare professional for guidance. E. Bridge to conclusion. Tracking progress not only helps you stay motivated, but also allows you to make the necessary adjustments to ensure that you're always moving forward. In the next section, we'll close the loop on the importance of stroke prevention and recovery, and offer empowering advice to reinforce your journey toward better health. Before we move into the conclusion, I want everyone to comment below about your symptoms or the type of disease you are concerned about. I will reply to the comments or address them in the next video, so everyone knows how to handle it. I'm here to help you achieve better health and happiness with the people you love. Don't forget to like and share with your friends to spread this important knowledge.
6. Conclusion: empowering your health journey with natural stroke prevention. In conclusion, preventing and treating stroke through natural methods is not only possible, but highly effective when done correctly. By focusing on a healthy diet, regular exercise, managing blood pressure, and incorporating supplements like omega-3 fatty acids and turmeric, you can significantly reduce your risk of stroke. For those already recovering from a stroke, incorporating rehabilitation practices, acupuncture, and cognitive exercises can make a profound difference in recovery and quality of life. The key is consistency. Adopting these natural methods requires a lifestyle shift, but the benefits, reduced risk of stroke, improved overall health, and better mental clarity are worth the effort. The earlier you start, the better your chances of preventing a stroke and improving your health long-term. Remember, your health is in your hands. It's never too late to take control, and by making small, manageable changes, you can significantly impact your well-being. Keep tracking your progress, stay committed, and always consult with your healthcare provider before making any major changes. With the right approach, you can live a longer, healthier life and protect your future.